We have the beautiful Dr. Ewa. She is a senior vice president of I don't know what's happening now. I'm like all out of their sync. She is the senior vice president of analytics and data operations, a visionary leader in healthcare. Her passion for bridging the gap between data and decision making is reflected in her strategic approach to aligning analytics with meaningful patient outcomes. Wow, amazing. I'm so interested in your talk, which is about understanding celiac disease, a personal and professional perspective. Wow.
Well, thank you very much for the introduction. I'm gonna try to share my screen. Let's see whether that's gonna work.
Yes. Yeah.
Okay. Can you see the celiac disease slide? Okay, you can. Perfect.
Yes.
Well, thank you so much. First of all, Marisa, thank you so much for the introduction, and Curti, thank you for letting me know that I can go earlier, so I can share my vision and my experience. As I was introduced, my name is Dr. Ewa Kleczyk, and I'm a healthcare executive. And talking about healthcare is very important to me in spreading the message of hope, but also how we can use data to bring access, bring more care to patients as well as their families, and continue the journey on improving all of our lives and making sure that each of us have the chance to get the best treatment at the right time and have the quality of life that we all deserve since we came to this world. Since May is the awareness month for celiac disease, and I'm personally impacted by celiac disease, I wanted to bring this to this forefront and talk about the disease that many of you probably have heard about but do not know much, and often don't see any disability with individuals or any issues with individuals who have the disease. So celiac disease is one of those diseases that is considered the unseen disease, where you cannot see from outside that someone is suffering, but yet inside they have either physical and or psychological issues related to management, as well as the symptoms that they are experiencing. So during this presentation, I will walk through some of the different insights and what can we and how do we deal with this. So during the presentation, I will talk about a little bit what is celiac disease. Many patients ask me, or many individuals ask me, what is a celiac disease? What are the symptoms? How do I know that I have celiac disease? What are some of the options for treatment? What is the public health implications? And then ultimately nutritional considerations and the great research that has happened over the years. So let's start with the brief introduction. I think many of you have heard the name celiac disease, and especially in the last 15 years, it has really become a forefront of autoimmune diseases fight. Autoimmune diseases or disorders are disorders where your own body attacks its own white cells and ultimately causes some kind of reaction. There are many diseases related to autoimmune. Many of us know rheumatoid arthritis, or we know Crohn's disease, or we know dermatological diseases, and even allergy at this point is I guess classified as a autoimmune disease when your own system is causing you pain and it's attacking. So the moment you are treating it, you have to make sure that your white cells in your body react properly to this. This autoimmune disease is triggered by ingesting gluten, and those of you who do not know where gluten might be appearing is in your bread. So all of your grains will have that, all of your rye and all of your barley. So individuals with gluten allergies have to really restrain themselves from consuming by these types of allergens. But in today's world, gluten is used as a spreader, as a thinner for many sauces, for soy sauce and so forth, and other sauces that are used in cooking, which makes it very difficult for those individuals. First of all, what does it do? If you are gluten intolerant, because there's also gluten intolerance, and ultimately the most severe part is celiac disease, you start feeling inflammation, and you start getting your intestinal damage, meaning you are not able to absorb food. So what does it mean is that when you're ingesting gluten, some individuals have reactions such as immediate response in their throat, where their throat may close up, which is called by it's part of the esophageal diseases components of the celiac disease, or others once they ingest it, they start having some kind of reactions that we can go in a moment to. But some of the issues when you digesting gluten, what it causes that your body is not able to ingest food, and ultimately you may become malnutrition. When I got diagnosed, I was normal weight. I was in my early 30s, and I was informed that I'm malnutrition. And it was quite a shock for me. So ultimately, what happened to me is I fainted at my workplace and was transported to the hospital. And after many tests, they find out that what was causing some of my issues, like fatigue, weight loss, as well as diarrhea, and also ultimately me not feeling very well, was the fact that I had celiac disease. So let's talk about some of the common symptoms. The first symptom is abdominal pain. So if I ingest any gluten, meaning if I eat any bread or ingest any even small parts of grains, I may actually have severe abdominal pain, and most people actually bloat up, meaning you can start seeing their lower part of their belly growing, meaning this is where you see where your intestines start swelling up. Many individuals have immediate either throat closing upon their body is preventing them to even swallow that. Occasionally that will happen to me, but many patients can start spitting food, for example, and others may have on the way on the other side they may have a severe diarrhea and ultimately even blood coming out. So there is many different ways this type of allergy can show up. Other individuals might never have any of these symptoms, but they might have rash on their skin. So their skin look very differently. And some of the dermatologists, when they see this type of rash, they can actually send for testing for celiac disease because it's not associated with eczema or any of the known dermatitis. It appears in a very small fraction of celiac patients and has a very specific way, the way it presents itself. So mostly it is through your digestive system, either at the beginning of your digestive system, middle of it, or at the end. And ultimately, some of the patients have only symptoms of rashes around your bodies that can be diagnosed by the dermatologist. Diagnoses have been quite difficult, quite frankly. After I was found on the floor at my workplace, it took good 6 months before they told me what was wrong with me. And from the beginning, like a couple years before that, I started feeling not so good after eating bread. I was getting bloated, but we were trying to eliminate via elimination of different foods to see what was making me feel good and what was not. But unfortunately, we didn't figure out ourselves that it was bread, it was the pizzas or all of the grain that was causing that. Right now, many patients, because of the increased awareness, and months like May help this with increasing awareness, and also there has been many different legislation passed as a result of patient advocacy groups such as Celiac Disease Foundation, which actually now the awareness, even at workplace, has increased tremendously. But normally, once you have any symptoms, you may go to your allergist or you might go to your primary care or a GI specialist, and they will run a blood test. They're going to do a specific panel for white blood cells. If you have spiked up, these are very specific ones called IgAs, and if they are higher, they might tell you that you have some kind of form of gluten insensitivities. When they are very high, that implies that you have celiac disease. Very often, as it was in my case, my white cells were actually increased, but they were not to the level that I could be able to be diagnosed with celiac disease. So they sent me for endoscopy. And after endoscopy, I was identified with esophagitis, which is the first part of your system reacting to gluten ingestion, and then ultimately having quite a damage in my smaller intestines, which ultimately gave the diagnosis of celiac disease. Many individuals, it takes about anyway from 3 months to a year before patients are diagnosed. And during the time frame, you are asked to continue eating gluten, because the moment you remove gluten, your symptoms may actually disappear. It takes about 3 to 6 months for your symptoms to go away if you completely remove gluten out of your diet. So during the testing part, when there is any suspicion of having gluten, you might actually, or gluten intolerance, you will be asked to continue eating gluten until you have diagnosis. And post that, removing any form of gluten can help resolve some of the issues within 3 to 6 months. So one of the things that most patients do not know is that gluten might actually cause infertility both in women and in men, but mostly in women. So many women in their 30s trying to get pregnant, they're going to find out that they are not able to get pregnant. But after having a diagnosis, they actually can very quickly, within 3 to 6 months, get pregnant. So there's always a caution for those women who were having infertility issues. When they're going to stop eating gluten, just be mindful that now your fertility actually might come back. There's also other components that many individuals are starting to see. Clarity as a result of not having brain fog. Many individuals, their sharpness increases, their way of assimilating information increases, so you can actually see cognitive behavior much better. The one that is very interesting, and this is where the importance of awareness and raising patient awareness or the awareness of the disease comes in, is the psychological component of it. We don't talk about it enough, meaning the moment you stop eating gluten, you can probably start thinking about it that you are not accepted or you don't feel accepted as a part of normal life. When you go to restaurants, everywhere there's gluten. When you go to family events, it's gluten. If you go to work events, there is always gluten. You cannot eat certain things. So post-diagnosis, it is often recommended to some kind of therapy and joining different circles of patients with celiac disease or support groups where you can actually talk about it. Because even for myself, even right now, many of the family members don't really believe that I have any disease. And very often, even if I bring in my own dishes, people try those and they not realizing they actually impact your food by putting their gluten infected, I would say, utensils into your meal. So there is a lot of complexities related to how patients actually can deal with this. So as we're thinking about the types of research that has taken place, so I talked to you about what is gluten, what is celiac disease, how can you identify the different types of forms, and how can you be diagnosed. There is also thinking about the whole research. In the last 5 years, the research has really, really increased. Now, major pharmaceutical companies are now doing a lot of clinical trials, not to solve the issue of celiac disease, because the best way to solving this celiac disease is not eating gluten, but really creating therapies for the emergency, like your family members not realizing that when they put infected by gluten utensil into your meal, all of a sudden you might be sick. They are creating pills similar to what lactose intolerance has, which are the lactose pills that you can take in the form of emergent resolving of the symptoms that you might have. Some patients might be actually required to take it before going to any events where gluten might be present. But let me go back. Celiac disease has been identified in 1940s, and believe it or not, it actually was in Europe and very often has been identified in Italian population where gluten eating is quite high. So believe it or not, Italy has the highest prevalence of gluten intolerance, and hence when you go to Italy, you actually have many different pastas in a gluten-free form. So overall, about 1% of worldwide population has been impacted by celiac disease. Only a fraction of them actually have formal diagnosis. So we still have a lot of work to do. Since the first discovery of celiac disease, there has been a lot of research done that shows how gluten creates, what are the triggers that gluten does, and ultimately what is the damage to your entire digestive system, and how do you prevent this. In the 2000s, finally, we started getting better and better way of treating patients and diagnosing patients, and also the food industry started catching up. I think at the beginning of 2000s, there was a fad diet related to, oh, don't eat gluten, you're gonna feel better. But it was really started to becoming very important for patients with celiac disease and gluten intolerance for finally having a way for eating breads and pasta, the things that normally you cannot eat, that were preserving the non-gluten inclusion into the food system. In the early 2010s, several organizations came to play, and their research started becoming very important in raising awareness as going to legislation and talking to Parliament about what are the ways for ensuring that the labels are correct, that we have the right way of thinking about patients with celiac disease, And how do we ensure that there is no discrimination when it comes to workplace, when it comes to treatment of patients? Because even if you think about it, you probably don't think about it, many drugs, many treatments that, let's say, can treat even your antibiotics are coated with gluten on top. So a patient with gluten intolerance, taking pill that very nicely go down your throat actually may cause additional damage. And that happened to me post one of my surgeries in 2000. One of the drugs that I was taking was actually was coated with gluten. So I had horrible symptoms afterwards. So what we had to do is we had to remove the shell and actually only take whatever was inside of that coverage, so we can then put it onto my food so I can take the medication appropriately. So for those patients who are listening, just think about it, that it's not only the food, but it's also your drugs. If you are going into a physician and have a celiac disease or you suspect it, mention something so the appropriate form of a drug can be given so we don't increase the impact. Overall, the public awareness has been much higher right now, and thankfully some of the legislations came aboard, but months of SMA really help create the awareness for patients. So in my summary, this is a little bit of a pamphlet that I have created that I often carry when I talk about to different groups and or reminding people what it is. Celiac disease is very common. It's all of the grains, all of the wheat, the barley, the rye. So it is really in a lot of our foods that we are ingesting. 1% of patients is impacted. Many of them are underdiagnosed. So if you see someone struggling, having some kind of bloating or abdominal pain that they're struggling with after ingesting gluten, maybe a discussion about what are the next steps might be the right thing. More and more patients that are pediatric are being identified, but also more and more women, especially in their late 40s and 50s, are actually started to be identified or diagnosed with celiac disease as a result of environmental changes. So the population is continuously having a variety of patients that might be impacted. So as we are thinking about what we can do, if you have someone who has gluten intolerance, be kind to them. Note that there is not only the physical component of it, but also the emotional, feeling excluded, not knowing whether they can participate in family events, feeling that they can be always impacted by ingesting by a coincidence, by an accident, and ultimately not always wanting to be with people because they feel like they cannot participate fully because they cannot have that beer or they cannot have that bread, or if you have a pizza party, party and you don't plan correctly, they might not be willing to come in. And the final note that I want to mention is many patients with celiac disease also have dairy intolerance, which makes it even more interesting because then you are pretty much excluding in the United States, I guess nutritional history, 90% of food. So just be mindful about what these patients are coming or what they are going through, what they are bringing to the table, and also how we can help them being included, treated, and ultimately feel like they are part of a community. So thank you very much for the opportunity to share my story and talk about and advocate for the patients with celiac disease and what we can do to help them be healthy, but also feeling like they are part of the community. Thank you very much.
Wow. So adding on to that, I can relate to every single thing you are saying as someone who can't have dairy or gluten. So I love your talk. I thank you so much for sharing this because so many people say, you look great, don't worry, oh, let go, enjoy yourself, have fun. And I'm like, you have no idea about how we function afterwards, how our body is feeling inside because it's almost so invisible. Well, it's ultimately so invisible. So I appreciate your talk so much, and I will 100% be sharing it. So valuable. And yes, thank you, thank you, thank you. And I even noticed this about like what you said, the coating even on like not paracetamol, but on pills, it's everywhere. And even yeah, like you say, family now, my mum will be like, oh no, what, can't you have this? I'm like, no, no, no. They just,
Mhm.
it's everywhere. So I appreciate your talk so much. It's so important right now. And yeah, even from a mental perspective, it's almost like you get invited to a meal and they've got no idea of the thought process you have to go through and what you have to investigate before just to not make a scene. So
Thanks a lot.
I appreciate your talk so much. Thank you, thank you, thank you.
Thank you. Thank you so much, and thank you for the opportunity to be here. Truly appreciate it.
Thank you very much. Yeah.